Ayan. Balik tayo, meron pa isa eh. Di ba kanina hypersecretion? O, ngayon, punta naman tayo sa anterior pituitary gland na hyposecretion of your growth hormone. And this, yes, si Peter Dinklage ba to? O parang, basta these two guys here have your dwarfism. Okay, so your dwarfism is actually the hyposecretion of your growth hormone, and it is assessed by your retarded physical growth. If you're going to look at the physical feature of these patients, okay naman yung trunk nila eh. Pati yung ulo nila okay yan. Kaya lang, yung limbs nila, yun ang problema. Kasi yung sa upper extremities nila, hindi man lang umabot hanggang doon sa may hips nila. Okay? And then, if you're going to look at your long limbs, lower limbs, as in very, very short talaga siya. So, this is evaluated as a premature body aging process. Nagkulang sila kasi nga, kulang yung ating growth hormone. So, you're going to assess for pale, dry, pero smooth skin ha. Okay? And then, you're going to also check for poor development of your secondary sex characteristics and your external genitalia. So, medyo maliit din sa kanila kasi nga dwarfism. Okay? Next, and you also need to check for your intellectual and your cognitive functions. Some of them might also be suffering from your cognitive dysfunctions, but in most scenarios, medyo okay naman sila. They are able to adapt themselves appropriately in the society. So, look at Peter Dinklage. He is able to adapt very, very well. Better than most normal people can. Okay, so that is your, nadoble, dwarfism. Okay, yan. I think in one particular cable network, they have this show talking about a family of these short people. Tapos yung kakaiba yung mga personality ng mga anak nila. Even the couple. So they have a program. I cannot remember if it's in the Lifestyle Network or somewhere else. Basta it's quite a very interesting take on the world of the mini people for that matter. So interventions. Sabi ko nga, ang problema dito is again your anterior pituitary gland. So hanggang hindi mo magawa ng paraan to fix your anterior pituitary gland, you cannot cure this totally. Okay? You cannot cure and resolve this particular issue totally. So, what can be done? I hope your patient was able to was diagnosed early on in his lifetime, so that therefore you can provide your human growth hormone injection. Because what's missing with your hypopituitarism is actually your growth hormone, right? So you provide what is missing. Therefore, in this particular case, your intervention is to provide your human growth hormone only if, the imbalance is diagnosed at a very early stage. Pero kung late na siya, di wala na. Hindi na siya, it's not going to be as effective as when it is going to be diagnosed early. Monitor for your complications. Okay? Asan na siya? Ulit-ulit naman. Ayan. Ay, yun lang. Yun lang ang ating dwarfism. Wala masyadong ginagawa dyan kasi nga, ang problema dyan is your growth hormone. Complication would be, have something to do, again, I think not much Yeah, not much. Complications siguro maybe because of the human growth hormone that's going to be injected to your patient. Okay, but marami tayong mga Filipinos na, ayan, mas marami akong nakikita na dwarf kaysa sa mga gigantism for Filipinos. But they are able to live a normal life actually. Meron pa nga silang may mga family pa nga sila, may mga asawa pa. O diba? Sana all. Okay. Next, do you have any questions for your anterior pituitary gland? Because we will be proceeding to your posterior pituitary gland. Okay, can I proceed with your posterior pituitary gland? It's already 6:08 na pala, ang bilis ng oras. Okay, I'm going to be discussing your diabetes insipidus. Well, this is just going to be a review of your, of our discussion in NCM 112. So, this is your posterior pituitary hypofunction. So, kulang sa aruga, kulang sa ADH hormone. So, an antidiuretic hormone is found in your posterior pituitary gland. Okay, usually seen in young adults resulting from damage or tumors in the posterior lobe. So, again, anong may kasalanan dyan? Siguro nasugatan o di kaya may traumatic event or there is your tumors in your posterior lobe of your pituitary gland. Hence, you have your problems, or there is non-release or decreased release of your anterior diuretic hormone. Anterior diuretic hormone, okay, pag wala si anterior diuretic hormone, ano ang makikita mo? Letter D and letter I, guys. So what did I say last time? DI is, in the vernacular, what is it? The mnemonics for that is what?
Dummy ihi.
Correct. It's your dummy ihi. Okay, so the patient here will be suffering from fluid volume deficits because you're going to have excessive urination, excessive release of your fluids in your body as a result of the non-presence or non-existence or non-secretion of your anti-diuretic hormone. So it may develop because there is your brain surgery. Ang sabi ko kanina, di ba, kapag gumawa ka ng hypophyseectomy, pwedeng matouch yung ating posterior anterior pituitary gland, and then therefore there would be a disturbance of your ADH. So yes, your diabetes insipidus can actually be a complication of your hypophyseectomy. So following brain surgery, or if there is your head injury or infection of your central nervous system, such as what? Your meningitis. Yan, marami po tayong mga ganyang kaso dito sa Pilipinas. Actually, one of a member or officer of the Philippine Nurses Association La Union chapter actually died. Kailan ba? 2 or 3 weeks ago because of your meningitis. Okay, so that's an infection of your central nervous system. Okay, specifically, parts and parcel of your meninges. So that is your, bakit na ulit? Diabetes insipidus. Well, ayan, there we go. Next, assessment. What are the things or the manifestations, clinical findings or clinical features that are present when you have your DI? I mean, this is a very, parang ano to? Parang alam niyo na to eh. So you're going to have your severe polyuria as much as 24 liters per day. Ano ba yung sabi ko dati? 5 to 25 liters per day. Okay, and as a result, your body's going to try to catch up with that loss of your fluids. So, to compensate for that loss of your fluid, you will have your polydipsia. Ibig sabihin nun, ano ibig sabihin ng polydipsia, guys? You have your excessive thirst, therefore you're going to have to drink and drink and drink and drink as a compensatory mechanism of the severe polyuria that the patient is experiencing. Imagine 24 liters per day. Kamusta naman yan, di ba? Dehydration, hello. Next, we have your evaluation of your fatigue and muscle pain as a result of that, fluid loss, massive fluid loss. And then we have, yes, I've mentioned, assess for dehydration. Alam niyo naman yung mga signs and symptoms ng dehydration natin, sunken eyeballs, you have your tented skin turgor, lahat ng mga yan. Okay? And yes, I've mentioned, ayan decrease in your skin turgor, you have your dry mucous membranes, you have your tachycardia. Tachycardia is, again, a compensatory mechanism of your body to pump out enough blood. Kasi nga, kulang na, di ba? There's a lot of your fluid that is lost in your system. So therefore, in order for your heart to actually catch up and still provide circulation and perfusion to all body parts, you will have your tachycardia, you will have, an increased or fast-paced heartbeat or pumping of the blood because it would like to still to catch up with the perfusion that is lost as a result of that severe polyuria. So, yan ang ating mga manifestations for your dehydration. So, sana, okay, makash up na nga ni patient natin. But, again, this cannot be resolved until we go to the root cause of the problem of your diabetes insipidus. Okay? Assess for weight loss because you have lost so much of your fluid. Remember, 1 kilogram of your weight is equals to 1 liter of fluid that is lost. Okay? So, kung 24 liters a day, kumusta naman yan? 24 kilogram ang mawawala sa'yo, good luck naman. Magandang diet yan, pero patay ka naman afterwards. Diba? You're going to have to be suffering from your fluid volume deficits and electrolyte imbalance. Mas mabilis pumategi doon. Okay? So, assess weight loss, muscle weakness, and also your headache. Okay. Next, what other assessment? Evaluate for the inability to concentrate your urine. You cannot have concentrated urine here because why? Everything is just lost eh. I mean, all of the fluids in your body is just removed totally from your system, so you cannot concentrate your urine. Apart from that, I have mentioned you have to check for your electrolyte imbalances, and you have to check also for your specific urine specific gravity. Okay, so less than that one, it's a call for you to tell or inform your physician. Serum sodium, kasi nga, wherever water goes, or wherever, yeah, in the same manner, wherever your fluid goes, your sodium follows, and vice versa. And then, since we are talking about your ADH, ang ADH natin is also called your vasopressin. That's innate and naturally occurring in our system for any normal healthy individuals. However, kung wala kang vasopressin, ibig sabihin nun, meron kang DI or your diabetes insipidus. So, i-check mo din yung serum vasopressin natin as part of your diagnostic examination to really confirm that there is your problem with your anterior pituitary gland. Okay, so your urine-specific gravity, your sodium, and even your vasopressin. Apart from that, since ikaw naubusan ka ng fluid, you're going to check for your hypotension. Kasi with a drop in your fluid, you're also going to be thinking a drop in your blood volume. And if there is a drop in your blood volume, there's also going to be a drop in your blood pressure. So assess for postural hypotension that may result in the collapse if not dehydrated. Kaya ang interventions natin dito, your patient will be given your fluid therapy, because you would like to replace all the fluid that has been lost due to your non-existence of your antidiuretic hormone. Okay? So that is for your diabetes insipidus. Implementation, what can you do for this patient? Maintain adequate fluids. Kakasabi ko lang. You're using 24 liters a day, 5 to 24 liters a day. You need to provide water. Okay? Increase oral fluid intake is the best, one of the best solutions that you can provide to your client. Kaya lang, it's still not going to be enough. That's why you will have to have your intravenous fluid therapy. Okay? So, since marami kang na-lose na fluids dito, you need to measure intake and output, even your weight. Well, I have mentioned already, 1 kilogram is equals to 1 liter of fluid. Okay, so that's importance of your medic alert bracelet. Kasi nga, di ba, this is a hormonal problem. So, ibig sabihin nun, unless you have undergone your operative procedure, you will still be suffering from the manifestations and the clinical features of this disease. And this is going to be for life until such time that you have undergone that the operative procedure. So it is important that you must have your medic alert bracelet. Di also in sa Philippines, but in other countries, it's very, very much an important part of these patients who have your chronic disorders, or those patients who have these, your critically ill patients. So, stress importance of your medic alert bracelet. Avoid liquids or fluids with diuretic type of reaction. Ano ba yung mga liquids or fluids with diuretic type of reaction? Any guesses, guys? You don't want to have an additional problem with your diuresis because you are already diuresing a lot, at least around 5 to 25 liters every day. So, avoid liquids or fluids with diuretic type action. Ano itong mga beverages or fluids or foods which has your diuretic type of action? Anyone? Guys? Anyone? Are you still there? Lininger, may 10 minutes pa tayo. 12 minutes. Yes, what are these examples of food or liquids which has a diuretic type of action?
Coffee, ma'am.
Yes, coffee. Ano pa?
Ma'am, tea.
Oh, yan. Sino mahilig mag-milk tea dito? Sino mahilig mag-coffee dito? Ayan, diuretic type of action. So if you have your DI, you need to avoid all of these things. Okay? Next, provide comfort measures if the client is on radiation therapy. Ayun, paulit-ulit na lang tayo sa radiation therapy natin. Again, because it is associated to the presence of your tumors. Kaya meron tayong mga radiation therapy to correct that lesions or to correct those tumors that is causing your problems with your posterior pituitary gland. Okay, so those are your implementation for your diabetes insipidus. Meron pa pala, same, provide preoperative, postoperative care for hypophyseectomy. Okay, next we have, meron pa pala. Okay, administer your pitresin or your vasopressin kasi nga, ito yung wala sa iyo. So, you provide what is missing. It can be done intramuscularly or nasal spray if ordered. Okay? So, ayan ang, nawala yung picture. Okay. Anyway, let's move on. Paulit-ulit. Again, let's go to your diet. What can you provide to these patients who have, problems with, with your diabetes insipidus? Monitor your diet. Low sodium, low protein with your diuretics. Next, administer your diabetes to potentiate your vasopressin or act as your antidiuretic. Next, monitor administration of your NSAIDs to increase your urinary concentration. And another one, give supportive care for your irradiation of your tumor. Same lang din siya. Okay, so that is for your diabetes insipidus. Now, let's move on to your syndrome of inappropriate antidiuretic hormone. Again, ang problema dito, si posterior pituitary gland pa din. So, itong si posterior pituitary gland, if you're talking about your DI, wala siyang ADH. Itong si SIAD naman, I think I have discussed this one already in your 112. With your SIAD or with your syndrome of inappropriate antidiuretic hormone, very inappropriate siya kasi nga, sobra naman, nasobrahan yung ADH. There is a lot or excessive secretions of your ADH. There is excess ADH that is released, but this is not in response to the body's need for it. It's because maybe attributed to your tumors again, maybe infections for that matter. So something is really, really wrong with this patient who is suffering from your SIAD. Again, sabi ko nga, it can be because of your brain injury, your trauma, you have your stroke, can also be one of the reasons why a patient is suffering from your SIAD. Malignancy, ayan, ito ang pinaka-favorite when you have your tumors or when you have your hormonal problems. It's always associated with your malignancies. Medications, yes, and even your stress. Okay, let me write there, infection as well. Ayan. Okay, that is for the predisposing factors of your SIAD. Okay, next, syndrome results. Kasi nga, sobra. There's a lot of your antidiuretic hormone. Let me reiterate, antidiuretic hormone. It does not allow you to diurese. It does not allow you to urinate. So what happens there is that you would just be containing as much fluid as you can without even urinating at all. So what you are going to be ending up with is your water intoxication and your dilutional hyponatremia. If you can still remember our discussion in your fluid and electrolyte imbalances. Water intoxication, you're going to suffer from, it's like drowning literally in all of the body fluids inside your body. And you will also have to deal with your electrolyte imbalance, dilutional hyponatremia. So, ito yung pinaka-main problems when you have your SIAD. So what? Okay, ayan ang itsura natin, no? Yung mga predisposing factors. If you can look at the picture here, these are the predisposing factors why we are suffering from your SIAD. Okay, so malignancy, you have your drugs, you have your primary brain injury or even your trauma to the brain, you have your infection. Sabi ko kanina, di ba, let me add your infection on that one. Hypothyroidism can also be attributed as, a secondary type of hormonal problems when you have your your SIAD. You also have your malignancy, and then you will be ending up with decreased serum osmolality, okay? And then you also have increased urine osmolality, decreased urine volume, as a result of that too much of the fluid inside our body. Okay, so, ano yung mga clinical manifestations natin when we have your SIAD? Number 1, water intoxication as a result of that volume fluid overload. There's so much of your fluid stuck in your system, you're not urinating at all. Okay, so, parang nagko-collect eh. Kulang ng collect ng fluid. You became a catch basin. No, not even catch basin, but you become a reservoir of too much of your fluid into your system. So, because there is there is going to be a lot of the fluid. Remember the concept of your osmosis? The movement of your fluid from one compartment to another through a semi-permeable membrane. This time around, kapag meron kang so much of your osmotic pressure inside your brain, sobrang daming tubig dito sa brain mo. Anong nangyayari dyan? You will have change in your level of consciousness. Kasi nga, you will also be suffering from cerebral edema. Okay, maalala ninyo yung natin, yung concept ng osmosis sa kapag kulang ng tubig, magkakaroon ka ng dehydration, your cells will be shrinking. But if there's too much of the water inside, you will have your edema, right? You will have your cellular swelling. Now, think about it. Think about all of the cells in your brain tissues, and they're actually being swollen, okay, by this large amount and massive volume of your fluid inside. So you will be suffering from changes in the level of consciousness, and even your mental status changes. Okay? Weight gain will obviously, ano bang sabi ko kanina, 1 liter is equals to 1 kilogram. So, kung ikaw ay hindi ka naman umihi, you will be expecting that you will have your weight gain, right? Next, hypertension. Wherever there is your high fluid volume, it will follow that there will also be your high blood volume. And if there is high blood volume, there would also be high blood pressure. Okay, well, as a result of that increased vascular resistance. So hypertension is very much expected for the SIAD patient. Tachycardia, again, napagod na si heart dito kasi sobrang dami ng tubig na pinapump out niya sa heart. So, para mas mabilis yung paglabas, your heart is going to compensate to do your tachycardic or to do your increase pumping. Kasi nga, masyadong lunod na si heart. So, kailangan ilabas lahat. So, tachycardia as a compensatory mechanism. Anorexia, nausea, and vomiting, ang client who is suffering from water intoxication will not be feeling much about eating. There would be decrease in appetite. Kasi nga, sobrang full yung sensation niya. Considering that one of the areas or systems in the body which is highly attributed to your water water distribution is your GI tract. So obviously, since that part is very much, accommodating this large amount of fluids, your patient will not be actually eating at all. There would be sensation of your anorexia, there would be sensation of your nausea, and even your vomiting. Okay? So, hyponatremia nga. Kasi nga, dilutional hyponatremia. Wala namang nawala doon. Kaya lang, na-dilute na siya sa sobrang dami ng fluids natin. So that is your SIAD assessment. What can we do for these patients? What are our interventions? Monitor vital signs, cardiac function, or your cardiac status, even your neurologic status, because you have seen naman your clinical findings and clinical features of your SIAD. Another thing is provide a safe environment, particularly for the client who has your anxiety. Maybe ang patient natin dito disoriented. Siguro ang GCS score ng patient natin ng ganito is around 7, 8, 9. So, mental status really needs to be checked every now and then. Neurovascular check is going to be very, very important here. Okay, monitor intake and output and obtain your weight daily because you are losing a lot of your fluid. So, it's very important that there is appropriate recording of all of the fluid that is lost and all of the fluid that is being maintained via the intravenous fluid, or maybe your per oral ingestion of your fluid for your patient. So it's very important that this has to be done by the nurse. Okay? Next, other interventions include monitoring of your fluid and electrolyte balance, because with the loss of your fluid, you also lose your electrolytes. Na-discuss ko na ito sa NCM 112. Next, monitor your serum and urine osmolality. Yes, because you are losing a lot of your fluid. These are very important parameters to check if there is your dehydration as well. Restrict your fluid intake as prescribed. Kasi nga, you are suffering from too much of the fluid. There is already your water intoxication. You would like to avoid further aggravating the patient's condition. Therefore, okay, restriction of your fluid intake is important. Wala namang sinabi doon na NPO eh. Ang sinabi nito is your restriction of your fluid, to the point that it is still considered acceptable by the physician, well, based on your physical findings, your physical assessment. So, restriction of your fluid is anticipated here. So, tuturuan mo talaga si pasyente kung paano i-manage yung ingestion ng fluids natin. Okay? Next, we have Yes. Since sobrang dami ang ating fluids dito, you need to administer your diuretics or your IV fluids, okay? Dapat normal saline lang siya or hypertonic kasi nga kulang ka ng sodium. So pwede yung hypertonic solution dito. Normal saline lang para hindi ka magkaroon ng problems with your osmosis, okay? Osmosis to your affected tissues or organs. So administering of your diuretics and IV fluids, those are one of the medical and pharmacologic interventions for our patient who is suffering from your syndrome of inappropriate antidiuretic hormones. Monitor IV fluids carefully because sabi ko nga kanina, sobra na nga yung water sa katawan mo. Okay? Kailangan mo pang magbigay ng ng medications. Usually kasi it's more effective if you have it intravenously. And at the same time, you still need to provide your electrolytes and it's going to be done via your IV. So it's very important that you need to monitor very, very strictly your input and output and even your IV fluids. Okay, because you would like to avoid the possibilities for another problem of fluid volume overload. Okay, so kailangan mo talagang i-check every now and then yan. Medications that inhibit ADH induce water reabsorption and produce water diuresis may actually be prescribed for this particular case. So yung mga diuretics natin, ito yung sinasabi natin. Yan ang ating interventions for clients who have your SAYAD. Okay, do you have any questions? Wala na ata ay. Naku, it's already 6:30. I cannot discuss your adrenal gland disorders anymore. Maybe I'm going to do a video recording so that I would fully discuss your thyroid, parathyroid, and DM next meeting. Ito, i-record ko na lang ito so that I can upload this anytime within this week. Okay? If there are no questions, I think let's call it a day. It's already 6:30. May questions po ba kayo? With regards to our, it's just your anterior pituitary and your posterior pituitary. Sana matapos ko ito. Okay, questions guys. Lininger, do you have questions? Questions? No questions? If there are no okay. If there are no questions, let's call it a day. Wait lang.
Thank you, ma'am.
Let's call it a day. Good night, everyone. And magpakabait kayo kasi Holy Week ngayon, ha? Okay?
Yes, ma'am.
Goodbye, everyone.
Yeah,
I will
ma'am.
be
Good night.
I will be distributing or sending to you your grades within the week. Okay? So goodbye, everyone. See you next week.
Bye, ma'am. Thank you.
Bye, ma'am.
Please
Thank
care
you,
of
ma'am.
everyone
Thank you
next
po.
week, ha? Okay, bye.
Bye, ma'am.